Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back with another Reddit story. On this channel, we do childbirth education, and some of that comes from Reddit, where we debunk myths, answer common questions, and chop it up in the comments. Make sure you like, comment, share, and follow for more. So today's story is from our baby bumps, and it says, Pain pushing even with epidural. Let's dive in. I'm just curious if anyone else feels the pain of pushing and the baby coming out with the epidural. I had my second baby, and just like the first, I didn't really get pain from contractions, but once the pushing started and the baby was coming out, it was such intense pain. It's like the epidural stopped working where my pelvis began. It was not just pressure. It felt like a huge boulder was coming out of my vagina, and I felt every bit of the pain that came with it. I had to take deep breaths so I wouldn't pass out, and I kept saying how bad it was hurting. After they gave her to me, I just sat there in silence, staring at the wall from the shock of the pain. I'm thinking this is a me thing since it's happened with both deliveries I've had. I'm just wondering if the epidural isn't all perfect for others, because I'm baffled when I read I couldn't even feel the pushing. LOL. So we are going to talk about why this happens, but first let's get into some responses. One of the first responses says, this same thing happened to me with my first, and I was like, WTF. I asked my OB about it after, and she said that every woman has different pain receptors, and the epidural works differently for them. I'm pregnant with number two, and so not looking forward to experiencing that again. Our next Redditor says, I really hope the first time was just a fluke, and this time would be a different, and I would be one of those women who said they couldn't feel a thing. The next Redditor says, same. I was in so much pain and was furiously pressing the button for them to up my dosage. I had expected something totally different, reading accounts where women said they didn't feel anything. A response to this says, it's pretty traumatizing when you're expecting a pain-free thing and it turns out to be some of the worst pain you've ever been through and there's nothing you can do about it. LOL. I definitely feel like they should be more open and warn women about this possibility so it doesn't come as such a shock at the last minute. Agreed. Had I known, I probably would have prepared better. The response to this says, what do you think you would have done to prepare better? Just mentally? I keep reading about this type of experience and it's confirming for me that I don't want an epidural, but it would really suck to go into not wanting it, then getting it, then having it not work. I agree. Someone responds to this and says, I think I would have just spent more time studying breathing and pain management techniques. Luckily, I had just enough knowledge to get me through, but I feel like it doesn't hurt to be prepared to do it unmedicated, even if you want an epidural. I think I was influenced by other women in my life who all had epidurals and made me feel like I didn't need to think about that stuff. I hadn't even considered that people might have different experiences. The epidural itself was easy for me, though, so I guess I don't necessarily regret doing it. Also, sometimes I wonder if it would have been even more painful without it. Who knows? If I have another, I think I might just try to be more mentally prepared. So, ladies, this isn't really that uncommon. There are many women who feel the pressure and the pain of actually pushing the baby out. And it's because the epidural does not cover those pain receptors. And while it does work for some, it doesn't work for all. So, I usually go into epidurals explaining to my patients that they may still feel immense pressure when it's time to push the baby out. The epidural is meant to block contraction pain, which this woman said was the case for her, but they don't necessarily guarantee that they block the pain of the pelvic pressure that you feel, which can be really intense. Now, about an epidural is a blind procedure, meaning that the anesthesiologist or the certified nurse anesthetist are going into this procedure knowing the common anatomy of every person. We all have sort of the same anatomy, and what they do is they press on your back and feel around before placing the epidural to figure out their landmarks, what your anatomy is personally, and then they go into procedure just based on what they feel and what they know. So not everyone's epidural is going to feel the same for that reason as well. So what do I recommend? I recommend, just as this woman said, to go into an epidural knowing that you will experience a certain level of comfort, but it may become increasingly uncomfortable as you get closer to delivery. When you're mentally prepared that way, you're not shocked out of your mind about what you're feeling. Also, practicing breathing techniques and meditation to get through the tough times will be advantageous. Also, in a previous Reddit post that I read, the woman mentioned that she would have to flip from side to side to get the pain medication to work. This is going to be because the epidural works by gravity. So if you are laying on your side, the epidural medication will drain all to that side. So what do you have to do to fix it? You flip over, and then the medication flows to the other side and hopefully evens out. There is the rare occasion where patients will need epidurals replaced because, like I said, it's a blind procedure and sometimes it doesn't get placed well, but that's actually really rare. It's also not very uncommon for patients to need a top off of their medication, which means that the anesthesiologist can break the line and go in and give you more medication directly to get you comfortable again. Now, I know that this post also mentioned that some women can't even feel pushing when it comes to delivering their baby, and that is true. And in those cases, your medical team will help guide and direct you onto how well you're pushing. So they might say, "Oh, push like you're having a bowel movement," and we can see movement of the baby, and we'll say, that's it, good job." Or sometimes they may even have to drop your epidural rate down to give you less medication so that you're still comfortable, but that you can actually feel where you're pushing without pain. So, my question to you is, do you plan to get an epidural? Are you undecided? Does this story change anything about how you will address getting an epidural or not? Make sure you let us know, like, comment, share, and follow for more. Bye.